Okay, so we're going to break this into the 3 follicular units. We're going to show how we're going to take that. Okay, 1. Okay, keep going. 2, 4. So the same one graft. Okay, there's 1 follicular unit. There's 2 follicular units. There's 3 follicular units. There's 4 follicular units. So now we took 1 graft and we've now created out of that 1 graft 4 follicular units. Okay, so now we're going to show you another example with that same 1 graft, what we can do to it. Now let's cut it into all singles. We had the 1 graft, okay, and now we got 1, 2, 3, 4, 5, 6, 7. We got 7 individual 1 hair grafts. You have the same product from 1 hair graft yielding you 7 hairs, or 7 individual grafts yielding you 7 hairs.
Wow.
Both of which will yield you the same amount of hair, but what the hair transplant industry neglects to tell you is they're charging you now for each individual graft, even though you're not getting more hair. The more that a graft is cut, the more of a chance that you're going to get transection of the follicle. So this was part of that graft before, because we had to cut it down.
Which you don't want.
Yeah, the more you cut it, the more you're going to lose hair, and it's going to cost the patient hair. We want to keep it as much in its naturally occurring bundles as possible. The more we can keep it the way Mother Nature meant us to keep it, the better off the patient's going to be. So the more I dissect it, the more transection, the more follicular damage, the less overall yield the patient's going to have. Wow. So what you're doing is you're paying more money for less hair. Yeah. And so that's what they neglect to tell you. And that's where the problem lies, is when they break it up like this, it does a disservice to the patient, it does a disservice to the industry, because the patient's getting less hair, they're getting less of a result, they're not happy, they're not telling their friends, they don't want to come back. It's hard to dispute it when you see it in this manner, but let's take a look at this particular graph that we just set down that broke it up. You can see those 2 or 3 bundles right on the top. Now it's a tiny little slit graft, so it's not to be confused with the plug. It goes in a little slit graft so the blood supply is not compromised, and basically we're just putting it back in its own environment where it was. So envision this, we're just going to take this little graft and put it right back in, and that's it.
Like it was always there.
Just like it was always there, because it was. It's
Right.
its own hair back right where it belongs. And that's it. So that's what we're doing, and that's what we do differently than everybody else. There's a better way to do it that's out there, where we don't have to dissect the grafts into these small things for no reason. And this is how we want the industry to go, so that way the patients will be able to have less procedures, less surgery time, they're going to have a higher yield, and they're going to have a higher overall satisfaction, because they're going to be happy that they have more density.